career development, to our December career development call, and I want to start off and wish everyone a happy holidays and holiday season. And today we're very lucky to have with us Assistant Professor Larissa Otero, who is a physician and an epidemiologist from Lima, Peru, from the Universidad Peruana Cayetano Heredia. And of note, she was a GloCal fellow herself back in 2015, 2016. So it gives us a great opportunity to hear from someone 4 years later and hear about their career trajectory and their successes. So I believe she's going to share some of her own background, but just to highlight, she received her medical degree in 2004 from Cayetano Heredia University in Lima, Peru. She received a master's in public health from the Institute of Tropical Medicine in Antwerp, Belgium, very famous international institute for the study of infectious diseases. She received that in 2009, and then in 2016 from the University of Ghent in Belgium received her PhD in health sciences. She's been doing some groundbreaking research in Peru with some of the issues with multi-drug resistant tuberculosis transmission and pediatric TB. So I'm very pleased to introduce this morning Dr. Larissa Otero.
Thank you very much, Jeff. It's a pleasure to be here. Lucia, can you confirm me that the slides are being shared?
They look great, Larissa.
Okay, great, thanks. So thank you, Lucia and Kimberly, for organizing this. Thank you, Jeff, for presenting me. Indeed, I was a GloCal Fellow 2015 and 16, and it seems that was years ago. So I'll tell you a bit about my pathway to where I am now. So as Jeff mentioned, I'm assistant professor at the School of Medicine in Cayetano Heredia. That's since a year and a half ago. And I'm a senior researcher at the Instituto de Medicina Tropical Alexander von Humboldt, also at Cayetano. And since 2018, I have a K43 Emerging Global Leader Award. I dedicate most of my own time to develop this, the project of my K43. So that's designing and implementing a pilot cluster randomized control trial of a behavioral intervention. I will explain a bit more in detail about this in the next slide. So last year I spent, this year I've been designing the intervention and obtaining the approvals, which took a long time, and doing the training for the staff that will be delivering the intervention. And we have just now started the pilot. We have 4 participants recruited. I also spent some time teaching and advising medical students in their thesis at the School of Medicine. I collaborate also in other studies. And I do consultancy for WHO on national reviews of TB epidemiology and surveillance system. That's in Southern and Eastern Africa, and also in the Americas, in Guatemala and Peru. So I'll start by the end, by where I am now, and then I'll go back to my career. So my K43 title is A Patient-Centered Intervention to Prevent Tuberculosis Among Children Under 5. So this is the background. For those not familiar with TB, all household contacts under 5 years old, so very young children who have been in contact with TB in the household should take a full course of preventive therapy because they have a very high risk of developing active TB, higher than those above 5 and adults. And the forms of TB they can develop are more severe, like meningitis, tuberculosis, and disseminated tuberculosis. So there is very strong evidence that they should all take preventive treatment. And there are several regimens. There are shorter ones, but the one still used in Peru and in many other settings up till today is a 6-month course of daily isoniazid. Isoniazid is one of the main pills we take to treat tuberculosis. To treat tuberculosis, you have to take 4 drugs combined, but for preventive treatment, you can take a single one. So we did a preliminary study that was almost just after GloCal, and we found that only 70% of these children were starting IPT and only 30% of them completing the 6-month course. You can see in the graph below of all the eligibles, only 72% got a prescription, 70% started, and 31 completed. So that means that 69% of children under 5 are at risk of are not being fully protected and are at risk of developing TB. So we developed a behavioral intervention based on a theoretical model for behavioral change, the information, motivation, behavior from Fisher, and on the qualitative findings we did with caretakers, healthcare workers, families with TB in the study district. We designed a cluster randomized trial in 10 intervention facilities and 20 control, and we will include 10 children in each. We expect to increase the completion of IPT from 30% to 70%. And below, in the slide below, you can see the 3 interventions we are doing. The first one is an information leaflet where we explain the caretaker why does a child needs to take daily IPT. This was one of the most frequent barriers we found in the qualitative interviews. Caretakers did not really understand why the child need to take it. The doctor that prescribed it does explain it, but sometimes not in so much detail, and they don't have anything written down. So that's what we give at baseline. Then we give them, we have developed a children's storybook that is given in weekly installments. The mother has to go weekly to pick up the pills, so we give each week one of these books for the child as a non-monetary incentive. And we also send SMS reminders the day before the mother has to pick up the pills so that she comes to the health facility with this system that you see below that was developed by a graduate from the Master of Bioinformatics at Cayetano. It's a system to send SMS. So how did I get up there? How did I get up? I arrived here. So as Jeff was saying, I graduated as an MD at Cayetano in 2004. My first job was to work as a field worker in a large health survey in a rural area of North Peru. I learned so much there. Then that was for 8 months approximately. And then I was a junior research assistant in a large smear-negative tuberculosis project that was conducted in Peru, Bolivia, and Cuba. That was my first contact with TB. After that, I went to do my master in public health in Antwerp. And after that, I had already decided I would do a PhD, but I wanted to gain more field experience. And I went to Uganda, to Arua, Uganda. It's in northwestern Uganda. And I worked for a year in a TB HIV ward as part of an HIV program that Doctors Without Borders was conducting there. That was an incredible experience. I'll tell a bit more about that in a minute. And then I came back to do the PhD in Belgium in a sandwich model. In Antwerp, they call these sandwich models when we do all the theory and all the coursework in Belgium, and I did the field work in Peru. This is a great model for people like me that I wanted to be based in Peru afterwards and to establish myself as a researcher in Peru. So instead of going for 4 years to Belgium and losing a bit direct contact with the ground here, I could be in both. I was sharing my time in both places, so I was in constant contact with what was going on in Peru. Then in 2014, I worked for 6 weeks with Doctors Without Borders again in the Ebola outbreak in West Africa. I was a field epidemiologist in Liberia, and this in Monrovia, Liberia, and this was also an incredible learning experience. Then I have had short-term trainings in person at University of Washington. I've been there twice, 2016 and this year, for 3 months each time to take coursework there that has been very useful on more advanced statistics and epidemiology that was important for my career. I have also taken online courses with UCSF. During GloCal, I took one, and then this year also on implementation science and behavioral interventions, and they were excellent. And I'm currently completing one with UW, also online, on leadership and management, which I actually recommend to everybody. It has been really good to to learn some soft skills that all researchers need. I was then a GloCal fellow. That was my first NIH funding, and now I have my K43 award. So I wanted to tell you a bit how my interests and career goals have varied in this course. At the beginning, when I graduated from medical school, I wanted to be an infectious disease and tropical diseases physician. That was my first interest. But after these two experiences in a health survey and in a smear-negative TB project, I became also interested in the public health approach of infectious and tropical diseases. After being trained, after receiving formal training in public health and epidemiology, I became very much interested also in methods, specifically in quantitative methods. And as I gained more experience in the field and in research, I began to be more interested in operational and health system barriers to optimal care, also in qualitative methods and implementation science, which are key, as probably many of you know, to improve the public health of populations. And finally, this is the text I wrote in my K43, which is the goal, my career goal, not to be an independent researcher at Cayetano, developing public health interventions to reduce TB burden, to positively impact the health of the Peruvian population with high quality evidence that informs health policy. So that's my career goal, and which this pathway I've shown is taking me there. So what did I value the most during this time? Definitely the training I've got, and also the mentorship. Mentorship, you must already know, is very valuable. I have had a dedicated and experienced mentors, both experienced in the field of study, tuberculosis and the specifics of it I've studied, and also experienced as mentors, which I think is very important. This is the feedback I used to get from my longtime mentor, which is my master in public health and PhD mentor, Patrick van der Stoet from Belgium. And well, he's old-fashioned and he still uses handwriting to correct me. And he's very, very detailed and meticulous, as you can see in the feedback. And I appreciate that very much. I have learned every time I received feedback on a manuscript, on a funding proposal, or on any document I gave to him, all this feedback I received in written form and then in a discussion has been one of the most important trainings I have had to develop into a rigorous scientist. Another important thing of mentorship is to have had a complementary mentorship with more than one mentor, which is something very important. I deeply appreciate the mentorship I have gotten from Patrick, but I have also complemented it with other mentors that have provided me career advice and many other key aspects for my career. Another thing I think I have valued most of this is learning from diverse opportunities and exposures. I have had the opportunity of being trained in Peru, in Belgium, in the US, and of working in Peru, both in Lima. Most, like 90% of my work in Peru has been in Lima, the capital, but also in the rural area where I worked at the beginning, and in Uganda, Liberia, and for shorter periods in Africa. And also from different persons, from peers I have met during all these experiences from all over the world, where I have learned from their own background, their own experiences. That's incredibly valuable for me. From academics and researchers, of course, from health staff and health authorities, and from the community. I think that learning from opening your eyes and gaining experience from multiple backgrounds and persons is incredibly valuable, and that makes us better scientists, and well, I think we can contribute better if we have been exposed to multiple learning experiences. I wanted to point out one of them. My experiences with Doctor Without Borders have both been life-changing, and I recommend something similar to everybody. It has I learned so much as a person and as a professional. These ones are pictures from Monrovia, Liberia. In the first one you see, I was a field epidemiologist, so we were in charge of the contact tracing and case investigation in the field. So in the picture there, you see the contact tracers, and we're going to to look for patients. This was an extremely difficult situation and an activity to conduct. I learned on the right, there's a whole team of contact tracers. Below, you see the Ebola treatment unit. In the middle, Christmas. I spent Christmas there that year. And then on the left below, one of the signs you would see around the city. This was one of the things I learned a lot, which is health promotion. Before going to Liberia, health promotion for me was something that could be done by, I thought, could be done by any doctor or any professional that had some common sense and some ideas on what had to be communicated. But there I learned that no, that actually there are professionals conducting health promotion and that it's a very, very important activity, especially in such a delicate subject such as Ebola transmission. The sign you see below is a bit too shocking and might scare the community instead of empathizing with them about the death of a relative or the sickness of a relative that they should not be touching, but on the other hand, their relative is dying, no? So they cannot not touch a baby or a parent that is dying. So I learned so much there, and this was not directly related to research, but I value these opportunities immensely, and I hope to have the opportunity to have more in the rest of my career. What did I find most difficult? Securing protected time for research. For a long time, that was very difficult, and I had to do multiple jobs and complement my time from different jobs and tasks. The other one was sitting down to analyze data and write, which is what we should be spending a large proportion of our time as researchers. I can now do that since I'm working in the K43. And also something about choosing becoming an expert in a specific area versus having multiple interests. I think I'm not a very good example here because most senior researchers will tell you that it's better to become an expert in a specific area and to go very deep there, which I agree, probably that's the best, but it's also interesting to be involved in different projects and not always see the same subject, because you can learn also from other diseases or health problems, other disciplines that can also contribute to the area you're more experienced. I work mainly in tuberculosis, but I'm always interested when students come with a project proposal on another area and I can help them methodologically, etc. So yeah, most people will recommend you, I think, the first thing to become an expert in an area, but I think that if you are careful and don't go too dispersed, I also think having multiple interests can also be valuable. Saying no is also difficult, probably for many of us. And in many cases, at least for me, it was not so much as, not that I don't have the capacity of saying, no, I cannot do this right now, but in many times I didn't want to say no because I didn't want to lose an opportunity. But then again, if you manage too many things, you won't be doing them well, or you won't be taking the best out of all these opportunities. So it's always important to say no, even if we don't want to say no. And then finally, the planning and supervising of fieldwork takes a huge amount of time, and that has to be balanced with sitting down and analyze data and write. No? However, this planning and supervising is key for the success of the study. You know, without high quality fieldwork, your research proposal, no matter how good is it won't work. So before going to the recommendations, I wanted to, I will give to you, I wanted to tell you a bit about Peru in this context. So Peru, for those that haven't come here yet, hopefully you will come all. It's a beautiful country. We have one of the best geographies in the world from my biased point of view. We have a coastline. We have, this is Lima, the coastline of Lima. We have the Andes, of which Machu Picchu is the most known highlight. We also have the jungle, the Amazonian jungle. We have the best food around. On the left, all the typical Peruvian dishes. On the right, some chocolate from the Amazonian jungle. However, all this is also exists in a country that has very large inequities. This is a picture of San Juan de Miraflores, where I am now conducting my study. So this is a hill where a lot of people are living in relatively informal settlements. And then we see an ambulance here at the back of the health facility. And why is this important for research? Well, one is that these inequities can be an important reason on why the health of the populations is not improving. So social determinants can be sometimes more important than technology and if a diagnostic test is available or not. And also because when you're conducting research, informed consent, of course, is a key aspect in order to have participants actively participating in your study. And informed consent to persons who live in poverty. In Peru, around 20% of persons live in poverty and 8% live in extreme poverty. Informed consent has to be extra careful, so that there's no coercion and a person living in poverty doesn't think she or he have to enter a study to receive care. You can say very clearly and can be written down on your consent form, but still that's not the same, that the perception of a participant can be different. So you have to be very well trained on responsible conduct of research. You have to know very well the context, and you have to make sure that the participants' rights are really respected at all times, and that you're acknowledging their perspective and not only ours for a study. Maybe we think that everybody's empowered to understand a consent, but sometimes you have to hear from the other side or from experienced researchers on how that should be best done. Another not nice aspect of Peru is the chaotic traffic. It's really, I know many cities complain of this, but Lima is one of the worst in the world. It's poorly regulated. We have too many cars, very poor public transportation. And how does this impact research? Well, that means we spend a huge amount of time daily in traffic. Just to go to Cayetano, it takes me an hour, so that's 2 hours transport every day. And to go from Cayetano to the health facilities where we work, that can take up to 1 hour and a half too. So we spend a large amount of budget in transporting the field workers to and from the health facilities and between the health facilities, and we lose a huge amount of valuable time being there too. So that's something to consider when we're doing research in Lima specifically. And finally, this is a picture of a demonstration in the front of the Ministry of Justice, of the Palace of Justice in Peru, and it's an anti-corruption manifestation. Peru has developed a lot in recent years with very good macroeconomic indicators. However, there are many aspects, such as the inequities I spoke about, that there's a long way to space to progress yet. And also there's a lot, we have weak institutions, corruption at all levels, macro level, micro level, etc., which is slowly being worked on. But that's something that also has to be taken into account when we do research, especially in the public institutions, because sometimes barriers, again, to care may involve this. You might propose an intervention that has been found to be effective, but then again, it doesn't work because there's some either an inefficiency or some other illegal, like corruption aspect that is acting as a barrier. So these are some aspects of Peru that can sometimes, and probably in many other settings, that have to be taken into account when we propose research studies. So now I'll speak briefly about some recommendations I have put together on grant applications and on disseminating research findings. So what can I recommend regarding grant funding for research? The first one is support from experienced researchers. You need to get detailed feedback on grant proposals, and both scientific feedback as well as strategic feedback. With scientific feedback, I mean on the methodology you're proposing, on the analysis you're proposing, and all that. And strategic feedback, I mean on who should you collaborate with, how should you present the idea so that it fits what the funding announcement is looking for, and all those things, it's very useful to get it from experienced researchers. This is something very valuable because these are very busy people, and they will be giving their valuable time to read throughout your proposal. So you want to take the best advantage of that while making sure, well, you can improve your study with that. But I found that extremely useful. I proposed a good idea. I wrote my grant, and then I got feedback from these experienced researchers, and it was really very, very helpful to improve it. The other one is that you actually have to plan and dedicate time to do it. No? If you have sufficient time to read, think, and write, you will eventually land with a high quality scientific proposal, and it takes a long time. My first application for the K43 took me like around 4 months, not full time. I was working and had many other activities, but at least 30% of my time during 4 months was dedicated to prepare it. Then the submissions, the resubmissions were slightly shorter. I had already a good starting point. Then reading the summary statement with an experienced researcher is also useful. At the beginning, I read it only by myself, and I thought I had gotten the information that is between the lines, and I actually didn't get some of it. So on the second time, I asked more advice from more experienced researcher, and they helped me understand better the points the reviewers were raising. And the other one is to be persistent. These are my 3 submissions. I actually got it at the 3rd time. In 2015, I got a 36, which was not bad, but not fundable yet. In the next submission, I got a 33, so that was a very minor improvement. And that's mainly, I think, because I didn't really get the summary statement. I mean, I read it, I understood it, but I really didn't grasp the worries of the reviewers. So for the 2017, my 3rd submission, that was massively changed and especially on the research part, and then I got funded. So be persistent. After the second one, I was a bit demoralized. I didn't want to send it because I said I'm going to spend so much time in it and it won't work. Well, I was convinced somebody convinced me to do it, and I did it, and it was funded. So actually, yes, we should resubmit and be persistent, either with the same funding announcement or for another one. Those are my strong recommendations for that. The other one is look for resources available. I got this book on the right this year, and it's a really great book that takes you through the grant application process in NIH, and it has very, very useful advice. I recommend you to have a look at it, and if you're interested in buying it, contact the program officers. Everybody tells you that, and they have been actually very helpful with me. And you can also write to PIs who are doing similar studies, etc. I've had also some experience with that, of writing people that didn't know me at all, and asking some advice on the direction on what was I proposing and how that related to the study they were doing. And not every time, but I have had some answers which have been very valuable too. Regarding dissemination of research findings, so research is relevant not only if you publish it, but when it actually improves the health of the populations. And for that, I can recommend that we have to plan and budget for dissemination, as it won't happen spontaneously, or if you want to happen, it really as best as possible. No, it's important to have a knowledge of the context. Our findings might have been effective, but are they also feasible and acceptable to be implemented in a larger scale? Are there other challenges or barriers we're not aware of, such as the ones I was mentioning in the health system or in human resources? Are there sufficient human resources to do all that? And also in cultural barriers. Scientific evidence of impact is only one factor for the uptake of an intervention, so you do have to take into consideration other contextual issues. And then we have to learn to switch from an academic and research language to a more colloquial language. How would we be explaining our research findings, the impact and the recommendations to a journalist, for example, who's not familiar with scientific language? So that's really important, a really important skill we all have to develop. And The more we practice it, the more we will do it. And then use multiple methods to disseminate findings. I'll show some examples. The most obvious one is to publish in scientific journals and conferences. For journals, you have to consider scope, impact factor, indexation, and scope is probably one of the most important, and who will be reading it. To attend conferences, also scope, and meetings and networking. Maybe your advisor will be at one of the meetings at the conference, and so you want to be there also to meet with him or to network with future collaborators. And of course, place time, and budget. I usually go to the Union conference, the annual TB conference. On the right, I'm presenting at one of them. This year it was in India, which was really far, and it was going to take me too much time from work to go, so I didn't go. So that's something important. And also the budget. If you have a grant that you have budgeted for to travel for conference, then that is great. And it's also important to go to global ones, but also to local ones. Now I try to go to the ones done in Peru, and you can get different experiences and learning different things from most of them. One of the most important ways to disseminate research findings is directly to users. This I mean to program managers, doctors and nurses delivering TB care in person. This can be done in person with a PowerPoint presentation and discussion at the, for example, in my case at the TB program, but also in health facilities visits. This is on the right, we're doing actually that. That's Patrick, the meticulous mentor that writes by hand all the corrections in very long documents. And we're at the health facilities where we work. In the upper picture is one of the physicians in charge of the TB program at a health facility, and below one of the nurses. And we're explaining what we found, and these are the preliminary data on the use of IPT, and we're also getting their feedback. No? So this should be done formally, in a formal meeting, but also visiting different health facility, because not everybody might receive the information presented in the meetings. It's really important that the users, especially where you conducted the research, really understand the findings. Another way to do it, and we always do it after the publication of a manuscript, is to present a policy brief. This is based on your manuscript, but in a short, like 1 or 2 pages maximum, very clear, non-technical language, summarizing the article, but focusing on problem findings and recommendations. This will be read by program managers who are not academics, so they are not so much interested in the methods you have used, but so much on, okay, what's the problem, what did you find, and what do you think we should be doing and why? This is extremely useful to do, and I recommend it to do it for every single paper you publish. Finally, another important way to disseminate research findings is with colleagues and experts. I'm a member since 3 years ago of the National Network of Pediatric TB at the National TB Program. Below, you see the picture of them. On the right, I'm with Dr. Mestanza, who's the president of the network, and Dr. Nair Lobaton, a child pneumologist. And they have developed the national guidelines on pediatric TB care just this year, which is about to be launched. And they propose research priorities and do conduct training all over Peru to improve diagnosis of pediatric TB. So this is also a great space to discuss findings as well as to propose new studies. Finally, social media. I don't use social media actually to disseminate research findings, but I do use them to read about other findings and trainings. I read a lot Twitter, and these are some of the hashtags where I have found valuable information. For example, that book on grant applications from NIH I mentioned a few minutes ago. I got it. It was recommended by somebody in one of these lists. So, well, yeah, I'm not a user. I only use social media for private purposes, or to consume all research findings or that what is published by others. But it's actually recommended if you like to use it for professional purposes. It's a great way also to disseminate findings, and you should be doing it in any social media you think is best. So finally, the first picture is when I graduated from medical school, like 20 years ago, I think, or 15 years ago. And on the picture below is the celebration of my PhD defense. I was so stressed that day that I forgot to take pictures, and that's the only picture I have of the defense. My father, my partner are there, and my two mentors, Patrick van der Stuft, who's my longtime mentor, and Dr. Carlos Seas, who's a very, very good ID at Cayetano, who has been my career mentor and also my PhD co-mentor. Tim Sterling, he's a TB expert at a world TB expert at Vanderbilt, and he's my main mentor at the K43. He has been a huge help also in these last 3 years. Joe Sant from University of Washington. He's also my collaborator at the K43 and an implementation science expert. Nicola Setola, he's also a Cayetano MD who later did ID in the US and now works in Botswana on tuberculosis. He has been hugely helpful also in my K43 proposals. Eduardo Gotuso, a world-known ID doctor, has been also a career mentor, very important for me. Tine Verdong, Elsa Gonzalez, both very good epidemiologists who were my first trainers when I was just starting in that, and they gave me immensely useful advice. They still give me immensely useful advice. We're now collaborators in multiple teaching programs and research programs. Angela Bayer she was in UCLA, then in Cayetano, and now she went back to the US. She's my main qualitative research advisor. Lina Shaw is my peer. We did the PhD together in Lima. She was doing it with University of McGill. And well, we shared all the hard stuff of conducting a PhD. Teresa Ochoa, she's the new director of the Institute of Tropical Medicine, a child health infectious disease specialist, and with extreme experience in large field trials involving children. This study I'm doing now is my first study involving children, so her help is very useful. Also, the Peruvian TB program have been key in my career because they've been also always very open to hear about new proposals of research and to propose also questions we should be addressing. So I thank them too. And the field workers, there are many that have worked with me, but these are the ones that are currently working with me, Maribel and Sila. So science is about data, so you always, and the data is generated in many times in the field, sometimes in the lab, so you have to make sure that who's collecting that data are really doing a good job, and so I'm very careful when selecting them, training them, and supervising them, and giving them all the support they need for them to conduct well their activities, and I have almost always been very lucky, and they are really great. And finally, in all careers, our family and friends, partners are very important. So to help us through the difficult times or through long hours of working. So that's a bit how I've gotten here and all the persons I have to thank for. So I think I'm a bit over the time. And I'm happy to take any questions.
Well, thank you very much, Larissa. Larissa, thank you very much. That was an outstanding, comprehensive presentation, and I think we can appreciate why you have a MD, MPH, PhD, an incredibly successful early research career, because your attention to detail, and that was truly fantastic. So let's open up the microphones to some questions. We have about 15 minutes or so, and I want to give the fellows an opportunity for a little bit of discussion.
Thank you very much. I'm Stephen from Uganda. I'm very glad to note that you were in Arua. I come from the eastern part of the country. I was fascinated about the way you pointed out the challenges of researchers. I wanted to ask about one of the challenges, which is number 3, choosing between becoming an expert in a specific area and multi-interests. At what point you arrive at the issue of TB?
Okay, thank you very much for your question. I have a large place in my heart for Uganda. It was a great time in my life. So I became involved in Peru has quite a high burden of tuberculosis for our region. The Americas region has in general low burden, but Peru has one of the highest burden. So we have a lot of TB. But then at medical school, I was trained mainly on the clinical aspects of TB, how to diagnose it and treat it. But I had no idea of the public health burden we had and on how it should be approached and how many gaps there were that could be easily, well, not easily addressed, but that could be addressed with available resources. And that's how I became interested in TB. The second job I had, I applied for a research assistant position at the institute, and the one they had available was on TB. So it was a bit of a coincidence or something anecdotal that I ended up there, but found it very interesting because of all the aspects it has. No, there are basic science aspects with so much more to develop, no, the latent TB to activation of TB understanding, and then also many clinical aspects that are important to follow, and public health aspects as well as social determinants. So it's, I think, it covers almost all the ranges in medicine and public health. So that's how I became interested in this, and also largely because of the high burden. No, it impacted me how much TB we have. We have 33,000 cases per year. I know Uganda has many more, but there are many reasons why we could have addressed that. No, Chile, for example, our neighbor, have I think 3,000 cases per year, and their incidence is maybe 10 per 100,000. Ours is 100 per 100,000. So I think we should be doing better, and I'm very happy to be working there and contributing with small aspects that could improve that.
Thank you.
Any other questions for Larissa? Larissa, I have a question regarding your training in Europe versus in the United States. How would you compare those two? I'm just curious.
Yeah, that's a great question. Well, I ended up in Belgium because Patrick van der Soep, my mentor, he was the PI of this first study I worked on, smear-negative TB. So I suddenly met this extremely smart epidemiologist that I had not interacted with a purely trained formally trained epidemiologist in Peru before. So I was fascinated on how all the things we could do with epidemiology in all the field. And the Institute of Tropical Medicine in Cayetano has a strong collaboration with Antwerp, Belgium. So that's how I ended up in the Master in Public Health, which I appreciated very much, and then did the PhD there. But then when I went to UW for the first time to get training, I also learned things that I had not learned in Belgium. And especially the more advanced statistical and epi stuff. No? The Master in Belgium is directed mainly to half of the persons are researchers and half of the participants are program managers. So it's very hands-on stuff on program management, and I learned a lot about program management, which I think is very useful, but not so much on advanced epi and statistics. You have very advanced epidemiology there at the institute, but the learning at the master is slightly more basic. And that is because they think that disease control managers don't need to know very advanced methods, but they need to know very well the most basic of epi and stats. So I agree with that, and I'm happy to have gotten that training. But I do think I also gained very much at the US on other aspects, especially the ones I mentioned, advanced epi and stats, that I had not gotten in Belgium. There are many other courses in Europe that do that, no, but I didn't receive them. So the perspectives, I think, are very similar, no? But something I also didn't have so much in Belgium is I had no idea about how to build an independent career and apply for funding, and my PhD mentor was more focused on the rigor of my studies, which is great, of course. and he's absolutely obsessive with a perfect methodology and really doing the highest quality possible analysis and manuscript. But then if you publish it, that's for him secondary. If you apply for funding, that's secondary. So that's not always so great for a career. And so I came to learn that a bit later. Still, I don't regret anything. I'm not complaining because I've learned so much from all settings. Another excellent thing I learned in Belgium is on health systems. No, there's a lot of discussion right now on the health system in the US, which I don't know in much detail, only what I read a bit in the news, in some journals. But I think Europe, especially the UK, have this very strong national health system with very high coverage. Well, now the NHS in the UK is also having funding problems and all that. So health systems is a huge question mark. What are the best models to deliver care to most people and in the highest quality possible? So in Antwerp, they have a very strong unit of health system research. I have not searched that in the US, so I'm not saying, of course, there is not, and I'm sure there is. But I think on that side, on health system research, maybe Europe could have a lot of contributions, in England, in France, with the social security model, in the Scandinavian countries. So yeah, I'm not an expert in what I'm saying, so this is just my impression of having been in both sides. And in retrospective, sometimes I think I could have done the master in the US, so to get the most basic, the most important training on stats and epi. But the PhD, I don't change it. I wouldn't have changed it because from my perspective, during the PhD, one of the most valuable things is your mentor. If you have a strong mentor, you will get there. You will become, I think, a good scientist. And my mentor was really excellent. So very dedicated and very detailed in his mentoring. So yeah, that's what I can say, a bit of the two. But I would recommend, if it's possible, to be trained in different settings. That's Europe, the US, in Asia, in Africa, in Latin America. I think these multiple exposures I have had have only enriched me. And I would never recommend somebody just stay in one place and only, even if that place is one of the best in the world, I would still recommend you to go to other places because you will learn from many.
Thank you. Do we have any other questions? Oh, okay, thank you very much, Larissa. It was an excellent presentation.
Yes, thank you. That was fantastic. And I appreciate everyone's questions. I'm sure they're available for everyone.
Thank you, Jeff. Thank you, Lucia. It was, and thank you all for attending and for the questions I had. It was a great pleasure for me to do this too. And I'm happy also to receive any mails with any questions you might have.
Thank you for persisting to win the grant.
Pardon me?
Thank you for persisting to win the grant.
Yes, and you should do the same. We should not, well, hopefully you get it. I'm sure many of you will get it in earlier submissions, but we should be persistent. I think that's key.
Yeah.
Well, thank you very much. Thank you everybody for joining. Enjoy the holidays and we'll see you in January.
Thank you.
Bye.
Thank you.
Bye-bye.
Bye, thanks.